Hey there, today we're going to talk about the stellate ganglion block experience. What we're going to cover today is how stellate ganglion blocks work, indications for stellate ganglion blocks, preparing for your block, including intentions and contraindications. We're going to talk about the office day and what to expect there. We're going to talk about what to expect after your block, some adjunctive therapies with your block, and also going to talk about stellate ganglion blocks with ketamine and the synergy there. And then we're going to talk about scheduling the other side. So how do stellate ganglion blocks work? So I always like to think about your computer. So imagine if you have too many apps open on your computer and then you get that spinning wheel of death. What's your go-to if that happens? Reboot your computer, right? So you reboot your computer, and then all the apps that you don't need close. And then when it restarts, you have a computer that works well, you don't have a lot of apps open. I think of that kind of as what's happening with our autonomic nervous system. So if we have too many thoughts, too many things going on in the past, too many things in the future, then we can't really be present. And then our nervous system starts to get a little bit like that spinning wheel with the computer. So if we do a stellate ganglion block, it's kind of like a reboot of the autonomic nervous system. Similar to with the computer, if you reboot the computer and then afterwards you open up a bunch of apps again, it's not going to work very well. So what you need to do is reboot the computer and then change the way you're doing things so that you don't have so many things open at the same time. So that's important to think about with stellate ganglion blocks. After you get the block, it's important that I think of it as kind of like wiping the slate blank. So if we wipe the slate blank and then you immediately go and do a bunch of stressful things like drink a bunch of coffee, go back into your stressful job, etc., it's kind of like reopening a bunch of apps again on your computer. So ideally, after you get your block, today, if you're getting your block today or whenever you get your block, the rest of the day, and ideally for a couple of days after that, really try to be mindful to keep your body in a relaxed state as much as possible. Things like gratitude journals are great. We have gratitude journals at the office that we love to give patients, breathing exercises, yoga, meditation, all those things are going to kind of help you to build neural pathways that are going to keep you more in parasympathetic. We'll talk more about that. So the parasympathetic nervous system is our rest and digest nervous system. Sympathetic is the flight and fight. So ideally, as much as possible, we want to be in the parasympathetic. That's going to allow us to heal. That's going to allow us to feel better. Sympathetic is what we need. If I all of a sudden turn into a bear now and we're in the same room, you want to be able to run out of here really fast. What happens with sympathetic is all the blood supply is going to go to your extremities and you can run out of here. When that happens, though, the blood supply is not going to your organs, not going to your digestive system to allow you to digest your food, and it's not optimal for health. We can thank our sympathetic nervous systems. All of us, anyone that's watching this is alive right now because our ancestors were really dang good at avoiding saber-toothed tigers. So that served us really well. What happens now, particularly after the pandemic, is our nervous systems are kind of in sympathetic all the time. We're kind of always on edge, and that makes it so that we're not able to rest, we're not able to digest, and we don't really feel good when that happens. So to the extent that we can get our body to tip over into parasympathetic more and only use sympathetic when we need to, the sympathetic nervous system is super important. We just don't want to be in it all the time. So anything that we can do to kind of help us get out of sympathetic and into parasympathetic is going to allow us to feel better and heal better. And the stellate ganglion block is one of the best ways that I know of to get us into parasympathetic. Of all of the treatments that I've done for the last 20 years of being a doctor, this one definitely packs the most punch. It's literally a 5-minute procedure, changes people's life because it helps to put our autonomic nervous system back in balance. If you think about, a puppy sleeping here, the puppy that's sleeping is resting and relaxing. The one that's all anxious is not. And so think about that with our nervous system. We want our nervous system to be chill, not like the puppy that's all worked up. Here's some other visuals to kind of help you understand the difference between parasympathetic and sympathetic. Anything that you can do to get us into parasympathetic is going to help us to heal and to feel better. So on the right side of the screen are a bunch of activities that you can do to kind of help you to stay in parasympathetic more after this block. So what we do in the office with any of our treatments is only a small percentage of whether or not things are going to work. So we're going to do this amazing treatment, and then you need to do homework to kind of keep your body in parasympathetic so that you continue to feel better. So things like meditation, relaxation, breathing exercises, etc. On the other hand, if you go out, you get in a fight with someone, you don't get enough sleep, then you're more likely to stay in sympathetic, and it's not going to work as well. This is another little diagram kind of showing what happens to your body when you're in sympathetic more versus parasympathetic. And I'm not going to go through it in detail. You can look at it yourself. But the point is that a lot of us, a lot of times, are in sympathetic. So potentially, if you're about to get a stellate ganglion block, your heart might be beating fast now, your pupils are big. And that's kind of normal. If you're going to get a needle in your neck, that's not surprising to have some anxiety about that. But if that's happening all the time, that puts a tremendous amount of stress on your body. Another little diagram here, kind of looking at the difference between parasympathetic and sympathetic and how it works on different areas in the body. We talked about this already, but which one is going to be better for our health, being in sympathetic or parasympathetic? Obviously, hanging out on a hammock and relaxing is going to be better for us to heal and feel better. And I get a lot of people that come in with musculoskeletal injuries, and they are wondering why they're not healing well, and it's because they're in sympathetic all the time. So you might be skiing and twist your knee, and if your nervous system was in the rest and digest parasympathetic state more, you would heal faster. If you're in sympathetic all the time, you're not going to heal that fast. So how do we upregulate our parasympathetic nervous system? The vagus nerve is kind of our main nerve for the parasympathetic nervous system. Stellate is the main nerve for our sympathetic nervous system. So here are some exercises again that we can do to stimulate our vagus nerve. When we do our blocks, generally we block both the vagus nerve and the stellate ganglion block. So it's a complete autonomic nervous system reboot. And then if you do these exercises after to try and help stimulate your vagus nerve and stimulate your parasympathetic, you're going to be helping to keep that, to draw whatever you want on that blank slate. So if you imagine that slate has a big mess on it and you wipe it, and then you can draw rainbows and unicorns and whatever you want after. The vagus nerve is also super important in terms of the connection between the gut and the brain. There's a lot of discussion about that recently. So I always encourage people, if they're coming in either for gut work or for brain work, that they address both. So if you're coming in to get a stellate ganglion block because you suffer from PTSD or anxiety or depression, or even just because you want a little bit of improvement with concentration and performance, it's very important that you optimize your gut as well. So if we optimize your brain with the stellate ganglion block, but your microbiome isn't optimal and isn't balanced, it's going to send signals via the vagus nerve back up to your brain. It's going to cause your brain to get inflamed again, and it's not going to work as well. Conversely, if you have gut problems and all the manifestations of that, and we only address the gut, we try and optimize the microbiome, and we don't address the brain is going to send inflammatory signals down to the gut. So it's always important that we address both together. And then when we look at the body as a whole, if you're having pain, if you are not healing well, if you're suffering from lots of infections, et cetera, it all comes back to the gut-brain axis. If we have inflammation in both of them, we're just not going to heal well. The vagus nerve is super important for this, and super important to send those signals to let us to rest and digest and heal. And you can kind of see along this diagram all the different areas in which the vagus nerve is important. People always ask, which side are we going to do first? And I don't decide until we get to the office and I have a discussion with you. But basically, most of the data is on men, most of the data is on the right side, and most of the data is on vets. And so because of that, if I don't know anything else about you and I couldn't get any more information, I would just start with the right side. That's what side I always start on. Now, that being said, the vagus nerve on the left side is more cardiac and GI innervation. So if you're struggling with perhaps something like POTS syndrome after COVID, or chronic GI issues, irritable bowel syndrome, leaky gut, any GI issues, I'll probably start with the left side first. With the right side, if you're struggling with emotional lability, feel like you get angry or irritated or upset really easily, probably good to start with the right side first. I also like to ask which side you have pain on. So if you have pain primarily on your left side, say your shoulder hurts on your left side and your hip hurts on your left side, or your neck hurts on your left side, we're going to start on the left side. Vice versa, if you have more pain on the right side, we're going to start on the right side. All right. Next thing we're going to talk about is indications for stellate ganglion blocks. And I think we kind of got a big picture here. We're going to get a little bit more specific. So stellate ganglion blocks, I think at this point, probably almost anyone in the world could benefit from them, especially after the pandemic that we've gone through. So on one side of the spectrum here on the left side, We have people that are suffering from insomnia, PTSD, anxiety, depression, maybe people that feel like they can't get out of bed, pretty significant mental illness. On the other side, we have really high performers. Everyone along the spectrum is going to benefit from it. So from the people who are suffering from PTSD and anxiety, there's pretty good evidence to support improvement in symptoms. And we'll talk about the stats on that a little bit later. It helps with concentration. So a lot of people that are students or CEOs or working stressful jobs will find that they're able to task switch and their concentration will be better. And then on the elite athlete side of things, then it improves shooting accuracy. It also improves concentration. And so we'll get elite athletes that come in and to get them because they want to get that little extra edge that they can't get from their training otherwise, to go from maybe third place to first place. There's been recent studies on stellate ganglion blocks improving long haulers with COVID-19. And probably the reason for that is it helps to get us in parasympathetic so that we can heal. They're doing studies on looking at aging with doing stellate ganglion blocks and telomere length. And as well, it's all pointing to the likelihood that stellate ganglion blocks are going to help us to age slower because we're going to be in parasympathetic more. We're not going to be stressed out as much. So pretty much anyone can benefit from it. Most of the data initially was for pain, complex regional pain syndrome, neck and arm pain, and then kind of moved into PTSD and then more into performance enhancement. So probably anyone's going to benefit from it at this point. Okay. Statistically, 80 to 85% of people are going to improve when we do one side. 85 to 90% of people will improve when we do both sides. And pretty close to 100% of people will improve when we combine stellate ganglion blocks with ketamine. And I'll talk about that a little bit later. What do I mean by improvement? If you suffer from really severe PTSD, does that mean if we do one side that you're going to be 100% better? You're not going to have any symptoms anymore? No, unfortunately, it doesn't mean that, but it does mean that you have statistical improvement. There are lots of people who have had significant PTSD that will get both sides done, work on their gut, and they go back to a place where they felt like they potentially never have felt like that before if it's childhood trauma. A lot of times I'll get people telling me they didn't know they could feel this way, which is pretty amazing. Okay, the next thing we're going to talk about is preparing for your block and some contraindications. So we know that our mind is super powerful. We don't really fully understand the extent of how powerful it is, I don't think. We know that, for example, cancer patients who think they're going to do well are much more likely to do well. And so I like to really harness this power of the mind as much as possible with really any of my treatments, but particularly with really profound neurologic treatments like stellate ganglion blocks. So I always ask people to have an intention going into it. The intention can be huge. It can be really broad. Like, I want to have the most perfect life ever. It could be really specific. Like, I want to not react with my partner as much anymore, or I want to be able to concentrate at work better. But we know that if you actually have an intention going into it, it's more likely that you're going to have that intention happen. And so it's kind of a win-win. We also know that if you think of the intention and you write it down and you say it, you're recruiting different parts of your brain. So it's going to be more effective. As I mentioned before, we have gratitude journals at the office. I always recommend that people take them home and do gratitude journaling for 30 days after. And when you do the gratitude journaling, I recommend that you write it down and that you share it with someone else. So you can take 2 journals and do that with a partner for the next month or a friend. And when you're in the office, I would recommend that you think about what intention you want and write it down. We always love to hear people's intentions, but even if you don't want to say it to us, that's no problem, but at least say it out loud to yourself so that you can recruit that part of your brain with it. Okay. Other things that we kind of do to set the experience for you, we play relaxing theta wave music that's going to help to recruit the theta waves of your brain. We also have essential oils, and then we make the room as comfortable as possible with pillows and heated blankets, weighted blankets. Weighted blankets are really nice to help your nervous system relax. So we put a weighted blanket over you. We do have to, of course, have the lights on while we're doing the procedure, but as soon as the procedure is done, we'll turn the lights off, and we like to let you relax in the room as long as we possibly can, and as long as you possibly can afterwards, to just let the block sit in and let you relax afterwards. Contraindications, really the main thing is blood thinners. And so if people take blood thinners, obviously, sticking a needle in the neck, there there's a risk of bleeding. And so if you have been taking any blood thinners, it increases that risk. And I should also just go over, in general, anytime I stick a needle inside anyone's skin, there's always a risk of bleeding, and there's always a risk of infection. We use a chlorhexidine alcohol spray when we're doing the injection. So the risk of infection is almost nothing. I've never seen an infection, but it's certainly possible. And then in terms of doing the actual injection with bleeding, I use a 4-hand technique. So I will be holding the ultrasound probe and I'll be holding the needle. And then one of my nurses or assistants will be holding the syringe. And so what happens, I use the ultrasound to find the perfect pathway to put the needle, avoiding any vessels, make sure that I get it exactly where I want it. And then my nurse will withdraw the syringe to absolutely make sure that there's no blood in there before injecting. So that makes it as absolutely safe as we can possibly make it. Also good to note on that point that the data statistically with stellate ganglion blocks was on fluoroscopy, which is 3D x-rays. We can't see vessels as well with fluoroscopy. We can't really see them at all. With ultrasound, we can see the vessels, we can see the nerve roots. So I think it's a much safer way to do it and much less risky. So if you happen to Google, the stats in terms of risks, it's much less than you see with fluoroscopy when we're doing ultrasound. All right, let's talk about what to expect the day you come in to get your injection. So the actual injection only takes about 5 minutes, really quick. And this is a picture of me doing an injection. You can kind of see here that I have the ultrasound probe, like I was saying, in one hand, and I have the needle. And then my nurse there has her hand on the syringe and she's injecting there. I will adjust the needle to wherever I want to put it. And then I'll ask her to withdraw and then inject really slowly. And oftentimes I'll move the needle around to get in fascial planes. So the fascial planes are kind of the areas in between muscles where nerves lie. So that's where the stellate ganglion lies. And then the vagus nerve lies in another or other fascial planes. So I try to get the numbing medicine in there so it spreads really well. And also into the area of the longus colli muscle. Before we do the injection, though, we're always going to put an IV in you. And I think of this as, if you bring an umbrella, it doesn't rain. It's really a safety precaution. So there are some people that we put the IV in, we do the injection, then we take the IV out after. In the unlikely event that anesthetic goes into a vessel, which again is very unlikely with the way we do it, I've never seen it happen myself, but in the unlikely event that happens, then we have intravenous access so that we can give medicines. The thing that can happen potentially if it goes in the vessel is you could have a seizure. So we have medicines that can reverse the seizure and also bind to the anesthetic. And so that's why we put the IV in. Oftentimes people will choose and elect to get some IV nutrients while they have the IV in while they're getting the procedure. We'll talk more about that in a bit. All right. As soon as we get the IV in, then we'll get you on the table, and then we want to kind of get the lay of the land. So everyone's anatomy is a little bit different, and I spend a few minutes looking around with the ultrasound to make sure that I can find the perfect pathway to put the needle. I avoid any structures that we don't want to put the needle through, like vessels or nerves. And everyone's going to be different. And so usually we'll take somewhere between 5 to 10 minutes of looking around to find the perfect place to put the needle, and then we'll begin the injection. And it's important to do that because we've got some really precious real estate in the area of your neck, as you can imagine, lots of big vessels, lots of big nerves. So we definitely take our time to find the perfect place to put the needle before we put it in. The actual injection, the needles that we use are these really fancy needles that we get from Japan called TSK needles. And they barely hurt when it goes through the skin. So people ask, can I get sedated, or can you do a little local first? We really don't need to. I certainly can. But I've done tons and tons of these at this point, and people just don't notice. They're always surprised how little it hurts when the needle goes through the skin. In terms of sedation, I really prefer not to do them with sedation. I've done lots with sedation, lots more without sedation. I've done lots of people who have done one with sedation, one without sedation. 100% of those people have said they prefer doing it without sedation. And the reason is twofold. One, when you get sedation, you kind of feel crappy after as the anesthetic, as you're metabolizing the anesthetic. But more importantly, the reason I like to do it without sedation is that when we do the block and you go from a state of feeling anxious, and then we do the block and you get relaxed, you realize that that's completely your nervous system that's making you feel that way. We're not giving you any drugs to mask it. Just by chilling out your nervous system, you feel way more relaxed. So I think that's a really profound thing that happens with people's nervous system with their brain when they realize like, oh, wow, like all that is chilling out my nervous system. And now I feel relaxed. So that's my strong preference. The other thing is, if we do kind of an in-between sedation, you have to be quite sedated for us to do it with sedation. If it's just kind of in between, what I found is people will lose their inhibitions enough to forget that they have a needle in their neck, and they might move their neck then, which clearly that would be dangerous if I have a needle close to one of your big vessels in your neck and you move your neck. And so if you're going to be sedated, you need to be quite sedated. And then there's just the sort of uncomfortable feeling of having the sedation in your system wearing off. And then you also don't get to have that profound feeling of the shift when we do the block. Certainly as an option to give some light sedation while you're in the office. We have nitrous just kind of help you relax, and then actually not give it to you while you're doing the injection as well. But in general, in the hundreds of these that I've done, very few people have ever really required sedation. Okay, next thing I'm going to cover is what to expect after the injection. So the number one word that people use to describe their feeling after a stellate ganglion block is a sense of peace. And I've heard this over and over again. And as I mentioned before, some people will say, I didn't know I could feel this way, or I haven't felt this way since before my trauma. But overall, it's just kind of a sense of peace. In terms of sleep, people ask, like, is this going to help my sleep? And how's my sleep going to be tonight? About a third of people will have the best night of sleep that they've had maybe in their life, the night of their stellate ganglion block. About a third of people won't notice a difference. And then about a third of people will actually have a pretty agitated sleep that first night. But overall, over time, with the vast majority of people, it improves their sleep. So that's great. It's great for sleep. And that's just, again, because we're calming down our sympathetic nervous system. The next thing that's definitely going to happen with everyone is you're going to get a Horner syndrome. So I haven't mentioned this yet. I worked in the ER for many years, and I've actually gotten 6 of these done on myself. Shift work for years and all the trauma in there. I would like to get another one now. It's amazing for concentration, and again, I think it's just good for your nervous system to relax it. So you can see in this picture, my left eye, my pupil is smaller. I have a droopy eyelid, and the white of my eye is a little bit pink. And so that's called a Horner syndrome. 100% of people will have that after, if it was a good block. And that lasts between 2 to 6 hours, just kind of depending on your metabolism. The other thing that happens is on the side that we do the block on, you're going to have kind of a hot, congested feeling on that side. And that's because the blood vessels on that side become dilated. So it'll kind of almost feel like you're getting a cold and your face feels hot. And that also lasts for about 2 to 6 hours. The next thing that happens with the vast majority of people is you lose the ability to speak and swallow. And this tends to concern a lot of people, understandably. The reason for this is the laryngeal nerve lives in the fascial plane very close to the vagus nerve. And so in order to block the nerves adequately, usually because of people's anatomy, we're going to end up blocking the laryngeal nerve as well. It's only going to be on the side that we do the block on. It's not going to be on both sides. And that's actually why we can't block both sides on the same day. People ask me that sometimes. You can only do one side at a time. It will feel uncomfortable, and your brain won't know how to interpret that, because your brain has never had the experience of having a numb laryngeal nerve, most likely. So what it's going to feel like kind of is like you have a gob of mucus in your throat. Of course you don't, but it's going to feel like that. What I've found now after doing lots and lots of these is the best thing is to not try talking, to not try laughing, to minimize swallowing. Because if you talk, that's when your brain's going to get this signal that you can't feel, that doesn't feel normal, that you have a gob of mucus. And then what I've seen people do is then they try and cough the mucus up. Obviously nothing's there, there's nothing to cough up. And then your brain thinks that it's doing a really good job protecting you to make you cough again to clear your airway, but there's nothing to clear. And so what I recommend people do is just relax afterwards, just breathe out of their nose. They can breathe out of their mouth as well, but certainly no talking, no laughing. If you're bringing family members or friends with you, just ask them, not to ask you any questions. We have little dry erase boards that you can write with after. We have little call buttons that you can push that'll alert us if you need anything after. Your laryngeal nerve is linked to speaking and swallowing, so they'll come back at the same time. So when your voice starts to get normal, that means that you can start swallowing again. Just try a teeny bit of water initially. And if that goes down well, then you can try a little bit more. I've had several people over the years of doing this that they have their throat feels a little bit dry and they try and sneak some water when their nerve is still blocked and they end up choking a little bit. Not dangerous, but uncomfortable. So do not, if you cannot speak and swallow, do not try speaking and swallowing. And that will last again for about 2 to 6 hours. Generally, the voice and the swallowing comes back before the Horner syndrome, that the pupil and the eyelid go back to normal. That's the eye changes are usually the last to go back to normal. The other thing that's going to happen is you're going to be a little bit off balance, kind of like a drunken sailor, and you're going to kind of fall off to whichever side you got blocked. And that as well is going to last for about 2 to 6 hours. And that's important to be aware of if you, once you get up, and certainly if you're walking outside in the winter or anything like that, you want to definitely be really careful and make sure that someone's helping you out. Other thing that's going to happen is the muscle that we block, called the longus colli in there, it's actually the muscle that allows you to tip your chin to your chest. And so what will happen is if you go home and, go to screw in a light bulb or put your head back in the shower, it's going to feel like your neck's going to kind of fall back and fall off of your head's going to fall back and fall off of your neck. Of course, that won't happen, but that's just something to be aware of. And that lasts for 2 to 6 hours as well. And the other thing that happens occasionally, depending on where people's nerves are, this is not as common, but it certainly is in the realm of things that can happen, is you can get some numbness in your face, chest, and into your arm on the side of the block. I've noticed that some people who have had neck surgeries before, have a lot of scar tissue, sometimes can get other shooting pains throughout their body. That's far less common, but it is possible. We always keep people in the office bare minimum of a half an hour, ideally 45 minutes, an hour, or even longer after their injection, so that we can see all the side effects that come up and talk to you about it and reassure you that it's absolutely a normal part of the block. Okay, and just another thing on that, the actual side effects of the block for the few hours after, they're a little uncomfortable. Again, I've gotten many myself. Lots of people have gotten more than one block, and it's a little inconvenient, a little uncomfortable. But when you zoom out and you look at how beneficial the blocks are over time, it's well worth it. And so, people will say like, oh, like I can't wait to get another block. I'm not that excited about the couple of hours after, but I'm super excited about the block. And what I found is, as long as people really relax after and kind of lie in the chair or lie on the table, they don't really have problems at all. It's more when they try to talk or anything like that problems happen. Another thing to mention is, after the block, I really recommend avoiding blue light for the rest of the day. So no gadgets, no computers to the extent possible. Really try and relax as much as possible, and ideally for 48 hours after that. I know that's not always possible, but if possible, that's the best thing to do. And then ideally not driving after. So I get people that come in from out of town. I strongly recommend that you stay in town the night after your block and don't drive, especially don't drive a long distance. We don't let people drive after the blocks themselves anyways, but even just being in the car. The reason I don't have people drive afterwards is because of all those things that I mentioned earlier. You're going to feel a little floppy, you're going to be off balance. I just don't think it's safe. And so after your block, in addition to not being able to eat after or drink, you're also not going to be able to drive. And so you're going to need a ride home after your block. And then I would recommend that you have something to eat and drink sometime before your block. Definitely don't eat a big meal right before your block, because you're going to be lying down. And if you get any upset stomach or anything like that, any nausea from it, you don't want to have a full stomach. But we don't want you fasting beforehand, because you want to be able to have something in your stomach if you're not going to be eating for a few hours. The exception to that is if you're getting sedated, then of course we would want you to have an empty stomach for that. But again, that's very, very rare that we do that. Okay, the next thing we're going to talk about are some adjunctive therapies that go really well with the blocks. The first two, Myers cocktails and glutathione, are a couple IV treatments that we do. They're really potent antioxidants, and it's pretty common for people to get headaches and nausea after. And the reason for that is the blood vessels dilate on that side, and it kind of feels almost like a caffeine withdrawal headache if you've ever had that before. And if you think about it, your body is producing its own natural stimulants. It's almost like it's producing its own caffeine, or if you've been really amped up for a long time, it's almost like being on meth or cocaine. So similar to if someone's on any of those stimulants long term, if we have someone that is on cocaine and we take them off the cocaine, they're going to feel terrible. They're going to feel really tired. They're going to get headaches and all that. But we know big picture that it's really good for them to get off of those stimulants. So it's kind of the same with our endogenous stimulants that we're producing. Even though potentially you might feel really tired for the first couple of weeks after your stellate because we're taking away your stimulants, we know that it's good big picture. And then when we take them away short term, more in the first day or so, and even that afternoon, it can cause sometimes with some people some pretty severe headaches. So Myers cocktails are a vitamin combo of B vitamins and vitamin C that are very effective for headaches. And I found that by giving people Myers cocktails and glutathione with the fluids in conjunction with their stellates, people tend to have fewer side effects, less chance of the nausea, less chance of the headaches afterwards. Regenerative therapies is also something, if you're interested in, we can chat with you about that. That's kind of combining regenerative therapies with the fact that your body is going to be really relaxed after and your blood vessels are going to open to your brain more. So potentially more potent there. And then NAD is a coenzyme that is important within our mitochondria with the Krebs cycle. It kind of powers the Krebs cycle, if you think back to biology. And if we don't have enough NAD, our mitochondria kind of are little engines in our cells and they don't have the energy that they need. So super beneficial to have NAD in terms of helping our neurotransmitters in our brain, and it helps to promote regeneration and help repair the brain. And so anytime I'm doing any treatments where I'm working on the nervous system, I'd like to add NAD. So with our ketamine drips, for example, I add NAD always beforehand. Stellate drips, it's an optional therapy if you want to add on IV treatments with it. We can do a combo of Myers cocktail and NAD, and a lot of people opt to do that as well. NAD is also really great at reducing inflammation and oxidative stress. Anyone that does biomarkers, checking things like Oura rings, if you have NAD or HRV and your resting heart rate improves significantly after that. All right. Next thing I'm going to talk about briefly is ketamine and stellate ganglion blocks and the synergy with them. So ketamine is a really potent therapy that you've probably heard of. And what it does basically is increase the GABA, which is your chill out neurotransmitter, and decreases the glutamate. And it helps to stimulate nerve growth of both parasympathetic and sympathetic nerves. Stellates block the sympathetic nerves. And so in theory, as you kind of like chill out your sympathetic nervous system, the ketamine is going to kind of help more proliferation of your parasympathetic nervous system nerves. This is not something that has been definitely proven, but in theory, it makes sense. So the combination of both of them, I think, is why we get really, really good results with both of them, because it really just pushes the body into parasympathetic. Okay. And then the next thing I'd like to talk about is scheduling the other side. So, and on that note, how do you know if it worked? So about a third of people will have a really profound experience on the table in the office. And so that might look like having a really vivid memory of someone that I treat lots of vets, and maybe I've had people that have a really vivid memory of someone that died with them in battle, or maybe a really vivid childhood memory. And it comes up in a way where you can release it, which is really profound. Sometimes people will be giddy laughing. Sometimes people will be crying, but a really profound experience. About a third of people will just kind of feel more relaxed, and they'll notice over the next few weeks, days to weeks, they don't react as much. You might be driving in traffic and normally you'd feel yourself getting really worked up, and you don't this time. Or maybe something that someone says to you or something at work would really set you off, and you're like, oh, it's the same thing happening, but I'm not reacting to it. And then about a third of people don't really notice much themselves, but it's their family members, friends, colleagues that notice something. So, if I get a block, maybe I'm like, oh, I don't really notice that much of a difference, but people see me, that are working with me, and they say, huh, Allison, like something's different. So that's also quite common. I get a lot of people that get brought in for repeat blocks by their loved ones who say, hey, so-and-so is ready for another block. They're kind of getting agitated again. It's kind of a good segue. In addition to talking about doing the other side, about doing another one in the future, I'll talk about that in a minute. But I pretty much at this point recommend that everyone do both sides. Whichever side you do first, try and schedule the other one as soon as you can. And I think of it a couple of ways. I think about it as like, if you have 100 units of stress coming in, maybe the first side takes away 50 units of stress, takes away 50% of that. And then the second side takes away 50% of that. So then you're down to just 25 units of stress. And if you think of a bathtub as your bandwidth of how much stress, how many internal and external stressors that your body can handle. If you've watched any of my other videos, there's a constant balance of all of our biologic systems and the robustness of them and all of our internal and external stressors. And that includes things like stress, infections, toxicity, lack of sleep, all of those things. So if your bathtub is basically how big how strong your biologic systems are, and then we put all those things in it, all the stressors, once the bathtub overflows with all those things, that's when we get overt illness and overt symptoms. And so any way that we can easily kind of pull some of the contents out of the bathtub out and give us more bandwidth, I always recommend doing that. And so stress is such a common pervasive thing with all of us that stellates really can help it's almost like taking a 5-gallon bucket and just, dumping a couple of big buckets full out of stress. And so then you have more bandwidth. So then if you get exposed to COVID, if you have a week where you don't get sleep, you're not going to end up having either an acute or chronic illness from it. So that's the first thing. And then people ask, hey, do I need to get another one at some point? So if I've done both sides, am I good for life? Do I need to get another one? And that really just depends on what's happening in your life. So when I'm treating people that are active military, active fire, active police, active healthcare workers, and they're still in the stress, then they'll probably need to get other ones, and they'll notice it. So again, I've gotten 6 in the past, and when I got my repeat ones, partially it was when I was in a place where I could get them because I can't give myself one, but also when I would get to a point where I'd feel like, my cognition's not quite as sharp, or I feel like I'm not sleeping as well, maybe getting a little more irritable, that's time to get another one. A lot of military people, when they go away and come back from their assignments, they'll get one then. If it's something where you had a stress in the past, like say childhood trauma, and that's gone, and everything else is great in life now, other than that residual effect from the childhood trauma, it's possible that you get both sides and you're good to go for a long time until you have another trauma. So kind of depends what's going on. And that's something that we work together as a team. And it also depends if you do your homework after. So everyone that I work with, I always think of us as a team. And so it's not just like, I do this treatment and then you go off and you're good to go. I do this treatment. And then like we were talking about with the wiping the slate blank, you need to go do your homework to kind of keep yourself in parasympathetic. So breathing exercises, gratitude, meditation, etc. So if you don't do those things, it's more likely that your symptoms that brought you in to get the stellate in the first place are going to come back sooner. For athletes, they'll notice, that they don't have the same edge that they did before. And so that might result in them seeking another stellate. And again, we can't do both of them on the same day because of the laryngeal nerve, because you need to make sure that we're only blocking one side at the same time or at a time. Okay, if you have any questions after listening to this, certainly if you're coming in to get a block, you can ask the questions at the office. You can also reach out beforehand and ask questions to any of our patient care coordinators. And I appreciate you listening. And again, this is of all the treatments I do, this packs the most punch and is really a profound life-changing treatment. And I'm really excited and can't wait to see you in the office.